then.
There you go. There you go.
It's coming up or it's already up?
It is. You are live.
All right. So good evening, everyone. Sorry about that. We're about 4 minutes late. I actually started talking at 7 o'clock, but we actually weren't live streaming. So thank you to Dr. Green and to my counterparts for letting me know that we actually weren't live, despite the fact that I had done an entire introduction. So I will start over. I am Dr. Maryam Jernigan-Noesi. It is my pleasure to be with you all this evening. For those of us who are joining us, myself, and Dr. Janet E. Helms for a second time. We're calling this our continued conversation, which we started about a week ago for the Academics for Black Lives during the week of survival and wellness. Dr. Helms and I are hoping, and I think it's it was my idea a few weeks ago to really elevate and to highlight the work of Dr. Helms, who's been doing anti-racism, white racial identity, and whiteness work for over 3 decades. And so in an effort to continue that conversation, we are interested in taking the conversation a little bit deeper. I have the pleasure and privilege of asking Dr. Helms some questions in an effort to hear her brilliance and wisdom. So we will continue the conversation with regard to white racial identity, ideally get to a space where we can talk more about systemic racism in particular, given that we define the 3 levels of racism in our last conversation, as well as some other interesting topics that I think folks will enjoy. So Dr. Helms, do you want to say good evening before I dive right in?
I do. Good evening for a second time. I'm glad you're joining us for this second conversation.
So without further ado, I'll just start. I had the privilege of interviewing you years ago when I was a doc student, and there were many stories that you told me during the time of the interview that I'm not sure made the article in the Counseling Psychologist, but certainly for those folks who may not have seen the article and are becoming more familiar with your work. One of the stories that you told me that was most memorable, as well as ironic, is your start. And specifically, your work has always been focused on race and culture, but your start with regard to white racial identity theory in particular. So I'm curious to know, given our audience tonight, if you sort of take us back, when did you first begin your work and what led you to studying white racial identity theory in particular?
You know, there are many stories, and so I don't know which one I told you. But if I were to say when it actually started when I was a child, maybe about 10 or so. My father used to keep me up till all hours of the night playing checkers. He always beat me. But one of the good parts about that was that he would tell me stories about race and racism. And he would always say to me, there are good white people and there are bad white people. And so you need to know the difference. And so he would tell me stories about how good white people had helped him and bad white people had not. So in a sense, I think I might not be different from most African-American people, that our parents start socializing us to think about white people as not just one mass of white people, but white people who have different characteristics. But that was not actually what I intended to get my PhD to study. I wasn't planning to study white people. But I happened to be an assistant professor at Southern Illinois University. And I was doing work on Black racial identity with one of my graduate students at the time, Thomas Parham. So we submitted manuscripts to journals and they would turn us down. They would say, how do you know there's any difference between Black people and white people? Why don't you study white people? So I studied white people because I wanted to get promoted. And that seemed to be the way to get promoted if I was ever going to publish anything. So with Robert Carter, when I moved to the University of Maryland, I sent him out. He's from New York, so I could send him out to do strange things. I sent him out to ask white people how they developed a white identity. And they didn't understand that question at all. So it occurred to me that white racial identity is very much like a person going to a foreign country where they don't understand the customs or the languages or et cetera. So actually, white racial identity theory is built on the notion of how do you acculturate to a different culture if you are traveling from, say, the United States to somewhere that doesn't have any of the same customs. So most people don't realize that. The other, maybe the hidden issue here is that if we are talking about institutional or systemic racism, one of the most difficult things was getting materials published because white people did not think about themselves as white. And they hated that I thought about them as white. And so a lot of my early career was focused on fighting for the right to talk about white people, if you can believe that. So
I can believe.
that's kind of how I started. When I did A Race is a Nice Thing to Have, the first edition, no one would publish it. So my sister and I did. We meant it to be a small $10 pocketbook that people could slip in people's desk drawers if they thought that they needed it. It's grown over the years, but we decided we would advertise it ourselves. So we sent checks to newspapers with ads for our book, and they returned our checks. They would not advertise our book.
Wow.
So finally, we had to take a word of mouth procedure, and we would send it out. Actually, my sister did all of the work. She would send it out to different universities, and eventually it began to catch on. And that's how people discovered A Race is a Nice Thing to Have. So
That
I
is
guess
the story that I recall.
is that the one you recall?
It is, because just there's so many things to take from the story, but I think as at that time, right, a graduate student who also was attempting to center race in my work, and talking about the challenges of publishing one's work, to hear that story was just a reminder to me, because, I'm meeting you and your advisee, after your work had become really popular and I would argue, more mainstream in terms of the field of psychology. But it was just a reminder to me of, a few things, both your determination, dedication, and what it might take, right, to remain committed to the work of centering race, but also anti-racism. And just the story about the fact that you were trying to study Black people, right, and no one thought that it was worthy, so they told you to study white people, but then didn't want you, right, to really talk about white people. So just the all of the nuance and irony in that is what sat with it continues to sit with me as a person who's moving from early career to mid-career, because, and we'll talk more about this, because of all of the gatekeeping, right, in the field and beyond, when one attempts to stay committed to the work of race and anti-racism in particular.
I think that we don't often acknowledge the extent to which institutional racism is built into the gatekeeping process. And so for those of us who are supposed to survive by getting grants, for instance, or writing books, when the gatekeepers don't acknowledge your work, then it's very difficult for that to happen.
Right, yeah. So I'll save some of my commentary. I am curious, before we continue to shift gears a little bit, but in the time, so the decades that you've been doing this work, I'm curious to know what ideas or thinking has shifted as it pertains to white racial identity theory. So what's changed or evolved, and what's really remained consistent about whiteness, about white people, about white racial identity?
Well, if I were to, I have to tell you, I'm not sure that much has changed, except that this requires people to be a bit familiar with my racial identity schemas.
Mm-hmm.
I think that now we have more people who can use their pseudo-independent or white liberalism schema than was the case when I first began. I think we also have more overtly reintegration people, or ordinary racism, as I sometimes call it, because now they're in conflict with pseudo-independence. And I actually think we have more immersion people who can use a schema to try to understand how they're responsible for racism and how they should change it. So I am optimistic that these are long-term changes, and I hope I had something to do with that.
That is interesting. because we've talked about just the current state of affairs, and when I mean current, I mean, past 3-4 weeks. And in particular, the shift in the ability of lots of people to even say the word race, to say the word racism, and even anti-racism. So I'm curious to hear you talk about what it is that you think in particular, right, about George Floyd's death has led to the shift that we are seeing now in terms of the public naming of anti-racism efforts. And as I said, George Floyd in particular, because if we go back to February, certainly when we saw, right, if we document the death of killing of Ahmaud Arbery, that didn't do it. And we said this before, Breonna Taylor, but something about George Floyd's death in particular really, I think, led to a shift. What do you make of that?
Well, Black men are symbolized in many white people's minds as beasts, non-human creatures. I think when George Floyd was on the ground calling for his mama, people actually recognized that he was a human being with parents, just like they might have. And I think that colluded, if you will, or was in confluence with the coronavirus, because people had to sit there and look. They couldn't escape. They couldn't turn on their favorite movie, because everywhere they looked, there was that scene that for people of color is very traumatic, but for white people it was their encounter experience, their experience of seeing that what Black people had been telling them for years was really true. And so my sense is that the white people who joined the protest movements were people who actually were able to get in touch with their sense of morality, their sense of themselves as human beings. And so they're out protesting what they see as an injustice to a human being. They couldn't see it for Michael Brown, even though technically Michael Brown was essentially a baby. He was only 18, but still they talked about him as though he were a monster. They couldn't see it for Ahmaud Arbery, although he was technically a baby too, a very young person. But they could see it for George Floyd. They wouldn't have seen it if he hadn't called for his mom.
Interesting. So there's something in there shifted the idea of morality, but the idea that he was human as opposed to the internalized stereotypes.
Exactly. He was human. He was not a beast. He was a person.
And thinking about the current movement, we've also talked about, and I've listened to other elders just talk about the difference in the protests currently. So observing across the nation, the crowds and who's in the crowds, et cetera. And for some, they've been applauding, the participation of the youth. Arguably, if we go back to, many of the protests, the younger folks, and by that I mean, college-aged, have really led or been at the forefront of many of the movements, including like the civil rights movement. But one major difference you talk about noting between the 60s and the 70s is really critically important, especially as we look at the involvement white individuals in particular. So we're seeing, young people out at protests. Folks are also noting that there are more racially and ethnically, diverse crowds at the protests as well. What are your observations, I guess, about the differences if we go back to the 60s versus the protest movements that we're seeing now currently as it pertains to race and racism?
It's really kind of intriguing because in a sense, most of the racial change in our society began as young people movements, which you would expect because they're the people who will have to survive into the future. But the demonstrations of the 60s were predominantly Black young people. Occasionally, there were white people involved, and I don't want to minimize their involvement, but they were not the young people. They tended to be older people who saw the injustice of not, for example, allowing Black people to vote. In the 60s, the young white people were on the side of anti-social justice for the most part. And so you could see them in the streets demonstrating against Black children integrating schools, for example. What became different or is different this time is that there are now more white young people who are involved in the protests or the uprisings against racism. I think that's important because white people do not like to hurt their own children. And so seeing them out there then leads some of the older, their adults, their parents, to support them in the efforts to make changes. And so we see that happening. But I don't want people to think that that means that all young white people have seen the light, so to speak. Because on the other side, we still have white young people who are doing racial violence crimes on college campuses. We still have white young people who would sit in a church and risk their life to hear someone make racist statements. So we have these two competing forces among white young people. And I think white young people are especially important to reach. And one says, I want social justice for everyone. One says, I want to maintain my white privilege. And so we have to keep working to move them towards the social justice perspective.
And what do you, as we think about what direction, you know, that young white people might move in, what do you think will be important in terms of not losing them? By said losing them, I mean with regard to the fight for social justice. So what are some of the things that we need to think about in terms of how to keep white people and white young people involved in seeking social justice as around race?
I think a part of it has to be helping and always talking about this as being a long-term movement. What happened in the 60s, white people were there until the voting rights legislation came through, and then they went home and paid for their mortgages and whatever. What we need to do for the young people now is to help them recognize that if we get the changes in the police system, which is what they're advocating for, there are still many other institutions that need to be changed. And so if they are going to be social justice advocates, then they have to work on those institutions throughout their lives. They might not work on them by protesting, but they always have to work on them to change them in ways that move us towards the arc of social justice.
I think we have a question.
Yeah, I think this question kind of goes in where you are currently. Can you talk about white racial identity theory and its application to post-2020 uprisings for Black lives for universities and other workplaces?
Okay, that's a big question.
You can thank Dr. Helen Neville for that.
Well, that actually is a good transition because our next layer of conversation really is getting into defining and understanding some of the language around systemic racism, institutional racism, and systematic. And I think there's plenty of opportunity. So Dr. Neville, please feel free to follow up if there are additional questions that arise. But perhaps we can start with, given that the question is around thinking about white racial identity and institutions. Can you, Dr. Helms, just sort of talk about the language that you're hearing? And I've noted three of those. So systemic is what we've heard folks use, systematic, as well as institutional. Let's kind of tease those apart a little bit for folks, if we can, and then talk a little bit about how white racial identity applies to institutional racism.
All right. As you know, I'm about people using explicit language when they're talking about issues of race and racism and ethno-violence. Let me start with systematic. Systematic to me implies that there are rules and procedures for doing racism. But as we know, or at least as we talked about, there are many different kinds of racism that occur in various contexts. So there's no one set of rules. I suppose if we were to think about what happens in the case of police violence, there are rules. The rules have something to do with police sees Black man, police harasses Black man, police shoots Black man, police says he was reaching for a gun. I suppose that's a rule or a script. But in general, we don't have clear-cut scripts like that. So systematic for me does not quite do it. It does not quite cover all of the circumstances in which racism happens. Systemic is actually a euphemism for institutional. And for me, systemic doesn't tell me where I need to intervene in order to change the racism. And so I prefer institutional because it says, in effect, there are these many institutions in society, and we need to intervene in each of these institutions wherever we see that there's a reason for intervention to happen. So that's why I use it. That's why I don't use systemic or systematic to define racism, but do use institutional racism.
So if we look more closely at corporations, institutions from a white racial identity lens, what schema, so using, your theory, would you say that you are noting from an institutional perspective? I don't know that we can totally generalize, but in terms of looking at the different ways we might diagnose institutions using white racial identity, I know that you've got some language around that, and we've talked about that previously, but it might be helpful for folks to hear that as well.
Well, I think that most institutions operate from a perspective of racial obliviousness, which in my theory is contact, where they don't actually recognize race or issues of race, other than they might know that they have to have, they might, and I do emphasize might, know that they need to have some person of color in their organization. But usually, unless there's turmoil out in the streets, they don't attend to racial issues at all. They're essentially saying that to be here, everyone has to act as if we're all the same and all have the same rights and privileges. That's how most organizations function. In many ways, that's also a subtle form of reintegration, because it's saying, in effect, you have nothing to contribute to our organization as a person of color, other than you are here and helping us fill a quota. I don't know that we talked the last time about the schemas as being blended, so that one could use more of one schema, but still have little elements of the other that influence how one interacts. So organizations often interact from a contact reintegration kind of framework, where they're both flowing. And so if you don't recognize when one is dominant, then you don't change that institution. Then, of course, there's pseudo-independence. I think we're beginning to see more of the pseudo-independence or white liberal perspective, but it also integrates with reintegration. And this is how it works. The organization recognizes that there's turmoil in the environment, and if they want to improve their environment, they need to do something about the racial turmoil. So what they say is, Black person or Asian person or a Latinx person, design some kind of intervention to deal with this issue. And then they leave all the responsibility to that person. Pseudo-independence means they have an intellectual idea that something needs to be done, but they don't take any responsibility for it. Reintegration, they locate race only in the person of color rather than locating race also in themselves. And so there are a diversity of kinds of ways that racial identity might show up in an organization, but those are the kind of ones that I have seen most often.
Yes, I think you've referred to the contact reintegration schemas as the institutional, and when we've talked about this as it pertains to educational environments, including higher ed, is the assimilation climate or environment, where the idea is that there's one particular group that rules there. Other people should become more like us, really conform to the unwritten and maybe explicit rules that are there. And what was helpful for me in terms of the pseudo-independence is that you naming that as the multiculturalism or the multiculturalist environment, for example. And I think that there are a lot of institutions that think that that's the goal, is a multicultural movement, but the idea again being that there's some value of group differences, but it's really superficial for the most part. And so there's some celebrations that may happen, potlucks, people, maybe having events where they're wearing different garb or paraphernalia, but very superficial as opposed to institutional. as you said. The most ideal, though, is the integrative awareness or the autonomy schema institution.
Which is, of course, where the institution is able to recognize the contributions of people, regardless of their racial, quote unquote, appearance. It's where they're able to be uncomfortable if they don't have a diversity of voices in their organization. One of the reasons that organizations keep making dumb mistakes in terms of their advertising is that they don't listen to the voices, or they don't have the voices at the table doing decision making. So in an integrative awareness perspective, what you're doing is you're not just inviting people to the table because they look a particular way, but you're inviting them with the recognition that the knowledge that they bring is actually skill. It's actually skill that the organization needs to listen to and integrate. And so if you don't have that, then you don't really have an organization that's functioning, at least from a social justice perspective, with respect to race and racialized ethnicity.
So do you have any advice or guidance that you would give to institutions that are just putting out statements, just making their commitments to begin the anti-racist journey? And we're seeing a lot of that, particularly in higher ed. I'm starting to see it, trickle down to K through 12 educational institutions, as well as, the corporations that have put out many commercials, announcements, statements, et cetera. What guidance or advice would you give them, given that framework?
Well, one bit of advice is that they probably need to use some consultants who have some experience in dealing with issues of race and racism. But if I would also say they need to take a look at their information. And I'm particularly concerned about the information that institutions send out that talk about the experiences of people of color. So for example, we want to hear about your troubles, or we want to make changes based on your troubles, but they don't talk about the experiences of white people. I am still waiting for an institution to write something that says, we as an institution take responsibility for our part in perpetuating racism, and we're going to take these steps to make sure that we don't do it again. If I could see a statement like that, then I would know that that institution was at least moving towards integrative awareness, but that doesn't happen as far as I can tell. People of color, or sad as it may be, are used to being in institutions that don't pay attention to them. So sometimes they may mistake an institution saying that we're interested in you as being real action. But that isn't real action unless they're also interested in themselves and how they can change.
It seems like one of the necessary steps for some institutions, corporations, et cetera, organizations that are committing to the work is really to think about, along with, consultants to help, really diagnosing their system, and really looking within at some of the, we often talk about sort of policies and the examples that exist. I'll encourage folks in the chat to either highlight some of the examples you have within your institutions, or to ask, continue to ask questions. Something you said when you just ended there reminded me of the conversation that we started to, or that we ended with last time, in talking about some of the recommendations that we might have for people of color in particular in institutions to survive and to attempt to thrive in predominantly white institutions, but also just institutions which are, arguably built on white supremacy. So I'd like to revisit that a little bit. It looks like, Dr. Green, there's another question.
Well, it's kind of in the vein of where you're going. Somebody wrote, I'm curious about what Dr. Helms and Dr. Jernigan would say to non-Black people of color who are being approached by white folks to discuss anti-Black racism and allyship. If we would like to help educate others, how do we do this well without centering our own voices, and instead appropriately centering Black voices? And I think this is coming from a non-Black person of color.
I guess I might have to start that with a question, which is, why are they approaching you to talk about issues of allyship with Black people? Do they not have any Black people in the environment? Secondly, I would say, in many respects, and I probably should should have some of our other associates here to talk about that. People of color have their own issues of anti-Blackness to deal with, and so I am not sure that necessarily approaching a person of color who's not Black and expecting them to know about Blackness is the most effective strategy a camp could have. But then, just to make it even more complex, sometimes people of color who are not Black share some of the conditions of oppression that Black people experience. And so if one can indeed put oneself in the position of cultural empathy, speak about the issues of your people. I don't know why we can't recognize the commonality that we have with respect to oppression. And in fact, if we don't, then we won't overcome it, because we need all of the voices to be able to talk together, even when our issues differ slightly. That would be my answer. What would you say, Maryam?
I think I had the same question you did, as the question was being read by Dr. Green, which is why, what would be the motivation behind that, other than, let's see I don't know how to rephrase this. It doesn't really, right, allow for truly addressing the issue, or maybe getting an appropriate, adequate response. And sometimes for me, that's an indirect way of sabotaging or not approaching the work in the most appropriate way. I'll say that in my in my non-immersion voice. But I think that your comment is well taken, in that I would question, because if I had questions and that question was posed to me as a person who was non-Black, I would question the person as to why they are approaching me. And if there are, other folks in the environment, how they would elevate again and include the voices of Black individuals that may be in the environment. And if not, then start there as to why that's not the case. But expecting someone else to answer a question about someone else, so to speak, as as it pertains to racial categorization, doesn't make sense. And so if you have to pause and ask the question, I would put the question back in someone else's lap, so to speak, and ask them that. Because it doesn't allow you to work towards a goal, really.
I would also say that tells you something about the person's racial identity. Mm-hmm. That they are essentially functioning from maybe pseudo-independence, but certainly some reintegration, where they think all people of color are Black people. Mm-hmm. And so they're approaching you because they don't see the distinction between the experiences of Black people and you as you as a person who is whatever you are. I have trouble doing the non-Black and the non-white thing, because it seems to me to minimize people. But as a person of color, they don't see you as having a distinct being or a sense of self. And I would be cautious around the person who invited you to engage in that activity.
What is it that you want, if we sort of stay in that line, want people of color, would you say that people of color, might benefit from in terms of reading A Race is a Nice Thing to Have? And I'm asking this question in particular because although I might, I've required it of myself, required it of the students that I work with, I think there's some folks that may see the book and the title of the book and think, oh, this is a book, for white people to explore their whiteness. But I think it's critically important, and certainly use the information in my own life for people of color also to have an understanding. But what would you say, or what do you want people of color to know about white racial identity, in terms of why it would be important for them to read A Race is a Nice Thing to Have, but how they can utilize the information?
Well, the part of the tagline is understanding the white persons in your life. And I think that's actually how I often use it. What it does is to give you information about different kinds of white people, if you will, the different kinds of schema that white people use and why they might use them. If you read through it and understand the cues for the different racial identity schemas, then you can save yourself a whole lot of time and trauma by diagnosing where the person is. For example, if I walk into the room and the person is heavily into reintegration or ordinary racism, I know that I am probably not going to have a significant impact on that person if I try to confront their racism directly. If I have to stay in the situation, then I'm not going to direct, I'm going to probably try to figure out what it is that they're afraid of. And then might do something to deal with that fear. If I don't have to stay in the situation, I'm probably going to leave. And so it's a matter of figuring out what you want from the situation, what you can do in the situation, and who it is that you're interacting with. And I think my book actually helps you to figure out those things.
I would agree. I think that was one of the most powerful tools that I had is when you said if you can, well, a couple of things that we say, right? Racial identity matters more than race. I'll put that in air quotes, meaning really understanding, right? Someone's racial identity development, but also that it gives you a blueprint. And it's given me a blueprint, as you said, for when I'm in situations, whether that's an institution and I've diagnosed the institution, but also interpersonally, because it really does reinforce that notion of, for me, where might I want to expend my energy? Do I, and in what way? Because I think the tensions around sometimes cross-racial dialogue for people of color can be really stressful. And I've heard, folks have conversations about, do I stay at the table and continue to fight? And how do I, push forward a particular, issue or perspective or point of view? And for me, being able to take a step back and to listen to maybe what a person is saying, arguably what they're doing, allows me to say, okay, in this particular instance, right, depending on how I'm assessing their racial identity, a couple of things. I can either give information, right, if someone's oblivious and clueless, should I so desire, and I may do that after a meeting, for example. Or I think the point of being in what we call regressive relationships. So one of the things that you told me years ago is one of the ways to survive a situation which is regressive, meaning that your racial identity development may be more sophisticated than that of the other, or in this case, the institution, is to leave. And that's given me permission to say to myself, I reserve the right to say no. Like, I'm not going to engage the conversation. I'm not going to respond to the email because there's not likely to be any, whether that's progress or success, and it serves to really preserve my own sanity and sanctity. And is probably the best thing that I could possibly do for myself in the moment. And then I can maybe have a conversation to determine whether or not there's something else that could be done either institutionally or otherwise with the individual or the institution. So I encourage everyone to read the book, but certainly to begin to apply and use the information in that way to really make decisions in the moment with your own self-preservation and again, sanity at the forefront as a priority.
And I would just add to that, recognize that people form coalitions around their racial identity. Mm-hmm. So before you jump in, just kind of get a sense of who's on whose side. Because if you're one person against a coalition in what Dr. Jernigan was talking about as a regressive relationship, then you don't have power in that situation. And so you will use a lot of energy trying to change the minds of 6 people or whoever is in coalition. Sometimes when you look around, you will find that there's someone who's a potential ally or a coalition member for you. And that's the person then that you want to align yourself with. And if it's a white group, you want to get that person to do a lot of the talking because white people listen to white people.
If we go back to even Dr. Neville's question and just sort of think about the many institutional examples and using higher ed, right, education as another example that we have, again, as I think about for those folks who are students or trainees or transitioning or somewhere in their careers, from an institutional perspective, it's also allowed me to make decisions about what institutions I might remain at versus strategize in my career and say, I'm at this particular institution for, a certain amount of time, but if I'm not being supported in my work, right? If there are ways in which there are gatekeeping that's happening, so my work in the community isn't being recognized, the types of journals that I'm attempting to publish in isn't being recognized in a particular way. For me, at various points, having counsel and making decisions about, okay, so how long, right, might I stay here, and how do I then identify the institution or the environment that's going to support my work? And I can say that there are lots of, I would argue, professionals, young professors, et cetera, folks in academia who often have the sort of mental exercise of deciding how much of themselves and their work, right, to put forth in their grants, formally in their papers, to put forth in the environment versus how much they may need to keep out, if that makes sense, depending on an institution. And so for me, one of the things that I've always looked for as I've transitioned, through a few institutions is, where's the place that's going to allow me to really center the work that I want to do and support that? And I can remember in my current institution, no institution's perfect, was the first time that, in looking at my CV, that someone said, no, we want you to talk about the racial trauma stuff. Versus, right, my either talking to you or talking to other folks about which aspect of, my research agenda should I present based on this, based on the organization. But the institutional diagnosis, I think, is what I'm reinforcing is also critically important, because if you stay in an institution that's not supportive, I think what I'm seeing is that there are droves of my counterparts who are colleagues of color that are just leaving academia, either being forced out by way of not being supported, not being promoted, or are leaving. And I think that that is something that's very concerning to me. And we certainly have had conversations about what that means for the future of the pipeline. So what would you, what would you say, Dr. Helms, to myself or to other folks that might be on the cusp of making, the decision about whether or not to stay and fight the good fight, right, within the institution, or to leave?
Well, let me answer something you didn't ask me first, which is I appreciate your sharing because it shows how one shouldn't internalize the racist things that happen to you. And the various educational systems, knowingly or not, will work very hard to minimize the importance of the work that you do. And so I, of course, am pleased that you have not internalized that, but I would encourage other people to also build up their resistance muscles so that they can say, it's you, it's not me, that's the problem. What I would say to people who are on the cusp is that a little guilt tripping.
Mm-hmm.
At one level, you owe something.
Mm-hmm.
You owe something to the people who look like you. You have received a remarkably privileged education. Something like less than 2% of the US population is probably educated as well as you are. And the reason you were able to do that is because many people died so that you could do that. So you owe us some time. You don't owe us your whole life, but you owe us some time. So I would say to people who are on the cusp, in the case of African Americans, if our people could survive slavery and Jim Crow and Reconstruction, then we could survive 3 or 4 bad years in an institution that doesn't appreciate our work. Then I would say, though, always keep a support system in place so that you can be sure that it's not you who's the problem. And then have an exit strategy. Decide where it is that you want to be, what it is that you want to do that's better than where you are. You may discover that you don't need it, but it's better to have it. Having the exit strategy then gives you something to look to the future for if in fact it's not working for you in the institution where you are.
I think that's the point about not internalizing what's happening in the system is really critical. It is what allows you to have it and to hold on to an exit strategy because, there's some confidence that you bring to the table in terms of your passion and commitment to your work and your ability to, ideally continue to work. But I think even for myself so for the folks that are, relating to these experiences, I will say that I have a solid support system. I was very fortunate, to train with my colleagues as well as with you and ISPRC, very strong parents. So I like to think that my, racial identity development is continuing to evolve. At the same time, there were moments where I struggled, and I literally had to say to myself aloud and to call some of my colleagues on the phone, who we laugh about this now, and just sort of say, like, I am not, like, this ain't me. This is not me. I'm not crazy. This is not me. Because the attempts to disregard, to really, dismantle, to even some cases, as you had to validate for me, sabotage some of the work that I was doing, or co-opt the work that you were doing, were so great, that even for myself with that support system, it was difficult in those moments. So I cannot, I would underscore what you said, in terms of being able to have folks that can guide you and that you can hear some feedback from, that will keep you encouraged. And always, as you said, do what you're supposed to be doing. And at some point, people will come to you. And that has rung true for me, certainly in my career. And to do what I'm supposed to be doing, let me be specific, is remaining committed to the work that I'm interested, invested in, writing as an academic, right? Writing, publishing, and continuing to be involved in the profession. And I would say the last 2 or 3 positions have come to me, as opposed to my having to seek them out, and they've been better.
So would it shock you if I said I still struggle?
No, only because of the conversations that we have. As I've grown up and gotten older, I will say, in our relationship, I think much like a parent does, right? You have shared more, and I think it's developmentally appropriate. And so hearing those stories sometimes, I think, are surprising, but at the same time are not. In what ways do you still struggle? Do you feel like you still struggle?
Well, actually, you said a lot. So let me talk about a couple of things. One is that after my first position, I never had to search for a position again. They each came to me. And the reason for that is what Maryam was saying. You do your work. It's going to be more difficult for you to do your work if you're a person of color, because you're likely going to be an only or a limited number of people like you are going to be in the environment. So that means that everyone who needs resources that you have will come to you. And so you're going to have to figure out how to balance your time so that you can do your work. Because ultimately the systems right now are not structured so that they value our work in the way that they should. So I did my work, and doing my work means that if I need a job, people come to me. It's sort of like being a basketball star. So that's one thing I would say. But I still struggle, or struggle isn't quite the word. Now maybe it's a little bit different. I look at things that people say and write now, and they don't cite me. And I can't figure out, should I be upset about that, or should I not be upset about that? And so that's always a question that I have. Because I do have a support system, even though people will write things that I actually talked about when I was a child 30 years ago, they will write them and not cite me. My colleagues who know my work and my students who know my work will at least say to me, well, you said that 30 years ago when you were a child. And that helps me to feel better, because at least I know that someone knows that I did the work, and that the work that the work now is important, even if the work then was not.
Mm-hmm. Yes, which, yes, can be in so many ways sobering, so to speak, to hear, but also I think important for many of us, in terms of thinking about what we need to, I'm saying we in terms of those folks that identify as people of color, need to hear, to remain also committed to, right, doing the work, as you said. And as I'm really concerned, I will say that, like I said, about my colleagues with regard to, it's the struggle really for me of, do I fight for a seat at the table, or do I build my own table? And I say that because the very real conversations are really about life and death, from the sense of like health disparities. So I see my Black women colleagues who are struggling with health and kind of know the institutions that they're a part of and the fights that they're having. I see my Black and brown siblings, really struggling with regard to, their health and well-being as well. And sometimes I do think there's a time to think about either exiting the system, but maybe not the commitment to the work. And so that's been challenging when you see someone, as I said, become personally compromised with regard to their own functioning as a result of the really toxic white supremacist systems that we're in.
And I think maybe sometimes it's that you do both.
Mm. Can you say more?
Just because you are in one position, for example, doesn't mean that you can't use whatever resources you have when you are not working at that position to do things that matter to you. Some of my former students, for instance, formed consulting firms where they essentially apply their skills with people who need the kinds of skills that they have. So you never want to feel trapped. You always want to build the skills that you have that you think are useful, so that one of the advantages of being educated is that you don't have to work for someone if you don't want to. You can always work for yourself. So always have that in mind and think about what you would do if you were not doing the job that you're doing now. That's so have multiple identities, multiple frameworks from which you can work.
Mm-hmm. Yes, Dr. Green.
Just a quick question that's following up really on that. It's not exactly this, but it's related. Do you think diversity consultants work? I interviewed at a school that said they were bringing one on, but when I think back on the interviews, I'm not sure what work is this consultant going to do for them. So can you talk about doing the work of consulting and maybe even using racial identity theory to do that work?
My general answer to that, which I may have said the last time, is that I don't trust anyone who says they're doing diversity consulting. And the reason for that is that there are many groups and issues, and the same rules, if you will, do not apply for each of those groups. So I want to know, who is it that you're coming to talk to us about, and what are your skills and experiences in working on these kinds of issues? I think Maryam, Dr. Jernigan, and I are personally working on something that has to do with how people think that they can walk into a setting where people are traumatized by race and racism, and with no skills at all, handle that situation. Well, what they do is they end up doing damage to the people of color, and they leave the white people thinking that they have learned something about how to deal with issues of race and racism. I'm not in favor of one-time diversity trainings. I think whatever training one has, there ought to be goals. The goals ought to be goals that the institution has, as opposed to canned goals that someone brings in. And I think one can do this kind of training with racial identity theory. And if they don't know what racial identity theory is, then I really wouldn't trust them.
Yeah, no, it's necessary. For me, it's been again, from a climate, if we use that language, or just an institutional perspective, having the conversations, being able to gauge the racial identity of the person that's seeking the consultation, but also from an institutional standpoint, it has really guided the work. And I always talk to folks about that the work should be iterative. It should not be one-dimensional. It should be collaborative, ideally, but also based on the expertise. And Dr. Helms, you said something really profound the other day when we were talking about this, which is that you use the surgeon example. I'll let you share that if you want to.
Well, you were doing so well, but okay, I can do it. If you needed to have some part of your body cut, you would not go to the first person on the street and say, cut my body for me. You would try to find the person who was most effective in doing the kind of surgery that you needed. I think the same is true for dealing with issues of diversity. You don't just take any old person who says they can do this kind of work for you. You actually test them out and see what kind of skills they have, what kind of training they have, what kind of experience they have with coping with issues of race and racism and ethno-violence. We live in an era now where people are aware of the issues, and so for profit or fame, they will just act as if they know what they're doing, but they don't always know what they're doing. So you need to check them out as much as you would your surgeon.
Yeah, I think I started by calling, sort of talking about the phenomenon that I was seeing, being really concerned as, again, literally from 1 week to the next, 1 day to the next, we went from no acknowledgement to all of a sudden, there's the anti-racism and everyone's committed and everyone wants, a consultation and everyone's writing statements. And that, for me is always a bit of a red flag. I'm happy, right, in one sense, right, that again, folks can name and start to talk about it. I also know that this is a long haul. And so I need people to be prepared for that, as opposed to thinking that one statement or one, I don't know, pool of money is going to address the issue, right, given the layers of racism and the history of it. But it also is concerning to me when things become trendy. Because when things become trendy, and I call this sort of the big social psychology, right? The conformity, right? Everyone, I would say everyone, because there's still some folks who are opposed, right? But the idea being that anti-racism is the thing to do. We've got to put out a statement. People are putting out statements. Let's all, organizations, corporations are putting out statements. But when things become trendy, you find the folks, there's soon thereafterwards, right? The folks who are going after the trend. And I can, again, compare that, and we can look at examples that also apply to, I should say, higher education as it pertains to grants that we've talked about. So I started out by talking about the phenomenon of ambulance chasers, right? Folks that look at the pain of other individuals and attempt to profit off of that. And then we sort of talked about opportunists, but this is what we're now calling racial trauma profiteers. And there's so many ways I think that we could approach this in terms of looking at who's attempting to profit from the notion of thinking about anti-racism, but also racial trauma. What concerns me are the proclaimed experts as well, but also the exploitation of the traumatized, which we talked about in our last conversation. And that shows up in so many different ways. So for me as a researcher, for example, who writes grants, I can recall having conversations and being in rooms where I was, one of few women, let alone one of few people of color, and hearing folks talk about, behind closed doors, right, that I'm not interested in this topic. This is where the money is. And so when things become trendy, it's been my observation, right, that then we begin to see it show up in terms of, whether it's, federally funded grants, et cetera, folks who are really interested in the work. So more funding dollars is one example that I'll use show up. And then you all of a sudden have a pool of people that are proclaimed experts who aren't citing the folks that have been doing this work, who aren't well-versed in terms of the topic area, but are seeking to profit, which is really concerning to me. Do you have something to add while we, as Dr. Green also brings in another question, Dr. Helms?
But just to add to that, the people then who receive the funding for doing the work are not the people who have knowledge about doing the work. It's the people who have connections. So that's another way that the gatekeeping system works.
You have a question?
Okay, sorry, I was snapping as she was talking. The question is, and I'm looking at the time and wondering if y'all were planning a wrap up, but this is a question that may wrap up, I'm not sure. How do we encourage continued social justice advocacy in white populations once a symbolic victory is achieved?
A symbolic victory?
I think the person may be referring to, although this isn't what they're, sort of like the renaming of buildings or the pulling down of statues. Some of those pieces that look very, that are dealing with symbols in and of themselves, but it feels like maybe that's an achievement, but she's pointing to, or this person is pointing to, what about continued social justice advocacy, especially among white populations? How do we encourage that?
Yeah, I would, this is my immersion moment. I'm not, my immersion moment, that was my disclaimer, so impressed, necessary, right, by just the pulling down of statues, because to me, we're still hitting surface. So if you go back to that part of the conversation where we talked about, systemic, institutional racism in particular, I think that following the trend or the ability to say race, racism, and anti-racism requires some depth with regard to what that means. And so for me, I've been waiting, right, to engage in the conversation, although I feel like that's the next trend. First it was statements, now we're pulling down things, and folks are really challenging language, which again, arguably we can say, okay, yes, we've talked about this for years, but that really doesn't get at the root of the issue. So I would hesitate to call it a victory. It might just be symbolic. It feels very surface to me still. just to surface, as I said, the next layer of writing a statement from an organization and saying they're going to do something. And then we will, take down this thing that's been sitting here that people have been telling us for a very long time is problematic. So in terms of keeping folks connected, though, Dr. Helms, that is something that was one of the questions, like what needs to happen to bring about long-term change, if I could frame the question in that way. I would say my piece of that would be that folks need to realize that it is a long-term commitment, and that it is not something that's going to happen in 1 or 2 weeks or with a statement or the pulling down of a monument or the erasure of a name. So I'll pause there.
I want to answer that by saying, whose responsibility is it to keep white people committed? It's not mine.
Mine either. Yeah. So that is a question for white people to ask themselves in terms of, and you talked about that a little bit with regard to the youth. What's going to keep them in the game, so to speak?
What's going to keep them in the game? What's going to keep their parents in the game? What's going to keep white people more generally in the game on the side of social justice? If I had the answer to that, they would be in the game now forevermore, but I don't. And so I think that's a conversation white people are needing to have with themselves.
We did have a piece of the conversation where we talked about what historically has facilitated points of progress and change.
You told me I wasn't allowed to tell people to burn down buildings.
What'd you say?
You told me I wasn't allowed to tell people to burn down buildings.
Well, as long as you give a disclaimer,
that
might show up somewhere.
The clear version is that every change we've ever had towards racial justice has been due to economics. So slavery was not ended because people felt sorry for the slaves. It was ended because of economic fight between the North and the South. The civil rights era, we had the boycotts and white people were losing money because people weren't using their services. In this recent uprising, people got involved as looters began to move out of their own neighborhoods into more expensive neighborhoods, and they saw that they could be hurt economically by this movement. So I suppose what keeps people involved is recognizing that if they don't do something about these issues, then sooner or later something economically challenging is going to happen to them. And so if they value at least that part of the society, then they need to begin to think about how to make sure everyone has at least a reasonable way of existing in our current society.
Hurting the pockets, as we said, in particular of white men.
I think in our conversation maybe ended with something from the book.
Mm-hmm.
So let me just see if I can find it. All right. Remember you asked me why would people change? Mm-hmm. And so I said, in part, I cover that in the epilogue. And so the thing I will say is that from the book, the white person can look in the mirror and like and respect the reflected person. A white person can look in the mirror and see a white person without also seeing guilt, anger, and confusion. A white person can know that he or she obtained privileges and benefits from society because he or she was qualified rather than because he or she is the best color. The white person can approach the world from a mentally healthy perspective rather than having to deny, distort, or avoid the realities of the world. The end.
We're just getting started as a collective, if we can call it a collective. Do we have any final questions, Dr. Green? There are some parting words in addition to just wanting to acknowledge and thank folks for being with us. But if there are other final comments or questions, we'll take those.
Sure, there is one question. Actually, there are two. One of them was about therapy. The other one is about really consistent with the way that you all have already been talking. I fear that many organizations will make these public statements and not change their behaviors. How do we hold these organizations accountable over time?
I think in a sense, the message is the same. If it doesn't hurt the organization the way it exists currently, then the organization won't change. And so you make noise, but you don't make it by yourself. If you're a person of color, you form coalitions with white people and actually let the white people make noise towards moving things toward a more socially just direction.
Yeah, I think a question I've been asking as maybe some of those corporations and organizations seek consultation, it's, we're committed to this, but they have no direction, no idea, haven't done any work themselves in terms of their own, identity development, but also just as an organization. So if you are seeing, statements without any concrete, comprehensive plans within the institution, that's a red flag for me. So really asking and challenging is part of making the noise in terms of, the statement says X. What does that mean? What does that look like? How does that show up within the institution or organization? And not continuing to let up with regard to those questions, as well as forming larger coalitions of individuals so that the voices become louder and can be heard. And aren't marginalized, right, or siloed.
Right. Although expect that you will be, and so a part of your energy needs to go into resisting the efforts to sideline you or marginalize you.
Mm-hmm.
Here's the last question, and I'm not sure if it points toward a future conversation that you referred to, Maryam. Could you ever see clinicians utilizing the racial identity development stages as criteria or psychoeducational materials in sessions with clients in therapy?
We do all the time. I would say that in terms of my learning of the theories, it was based on the books that, and Dr. Helms, you'd said this in the interview from the counseling psychologist, is that it was your hope that people would learn to apply the theory. But in terms of work that I do around racial trauma, that's where I start. I mentioned this in the last conversation. And I think it also, to me, ties into another dimension of thinking about racial trauma profiteers. So the therapists and folks who are adding racial trauma treatment as a part of their specialty from one day to the next, but don't have a good grounding and theoretical framework for me is racial identity theory, and being able to do, again, a racial socialization assessment, a racial identity assessment to know when someone's talking, how you can begin to assess, right, the schemas that they're utilizing from a developmental and a contextual standpoint is what allows me to get to the place of treatment planning. So I think that it's been a notion, I think, for a while that racial identity assessment should be a part, and that includes for white individuals, that it is, when I work with white clients as well, of the assessment process. Now, I don't think it's taught explicitly in a lot of training programs. But certainly, I know Dr. Green, you use it, I use it, I would say many of our colleagues use it, but there are also other folks who maybe didn't train with us that do as well. Do you have something to, Dr. Helms, you can add to that because you wrote the several texts.
I would just add to that many of the clinical training workshops that I do are designed to teach therapists how to use racial identity theory. And I think it's particularly important for white therapists because there are more of them than there are therapists of color. And they don't get that training for the most part in their formal education. So one way that you can make sure that you get the training if you don't is insist that your CE credits or events that actually help you to learn the kinds of racial identity skills that you may need in your work.
Yes, because the other layer of conversation in some of those trainings that we haven't we've referenced but haven't talked as much about, but certainly we have in other settings, is the idea of the social interaction model, which is, the application of thinking about and in your own racial identity, schema, status, and that of another individual, and how that plays out from an interpersonal standpoint. And that's sort of the 3.0, I guess, conversation or training. But we always talk about the fact that that's really where we'd like to have the conversations and where the work is. But we hope that folks will continue to at least get the foundation of racial identity to be able to continue those conversations and those trainings. And if you're in a training program and folks, you're not being trained, I would make a little noise as a student in terms of, looking at the curriculum and and insisting upon having the content.
If it helps your cause, just to remind your professors that racial identity theory is in the licensing exam.
It sure is. Sure is. So on that note, if there aren't other questions, we're a little after 8 o'clock. I recognize it's the evening for most folks. I did want to end by, making reference to our Diversity Challenge 2020, which is happening in October of this year. It's the 20th annual Diversity Challenge Conference via the Institute for the Study and Promotion of Race and Culture at Boston College. It will be virtual this year, and the theme is Goodbye Isms and Hello Future. And it really is, I think, in reference to one of the last questions, which was about, keeping folks in and committed to social justice, anti-racism for the long haul. But in coming up with that theme, I'll sort of end here, Dr. Helms. What do you imagine, what do you hope, right, is the future with regard to race, anti-racism work?
Well, ultimately, my hope is that I never have to write anything else again about racism and anti-racism, but I doubt that that's going to be the case. But what I'm hoping is that at the presentation, people will begin to present their work and talk about their work in a way that lets us see what a future without racism might look like from their perspective. I don't know that we've ever had that kind of conversation. And so we will talk about what it looks like now, but we'll also anticipate what it's going to look like when we fix it.
And I will, in my parting words, not to take the last word, is something that I've also learned from your wisdom in my most discouraged moments as a person of color, inundated, it felt like drowning at the time in just whiteness and white supremacy. And I asked you, like, there's so much work to be done, like, how are we supposed to do this? And you said, well, it's like a pie. You meet people and everybody takes a slice of the pie. You can't do all of the work yourself, and you certainly can't do it, in every realm of your life. And so it becomes really important that everybody does their part and remains committed, and that your dad, who you mentioned in the beginning of the book, right, is who taught you to keep having hope, in particular for white people, and was committed to attempting to re-educate them. And so that, I think, in those moments of discouragement really kept me going in terms of, okay, so we have to have hope, but also, thinking about just everybody taking a little bit and building my network so that we can all do the work. So I will encourage people to take a look at, if you haven't already, A Race is a Nice Thing to Have. It's a very short but important, impactful read, and there are many others. So ideally that will pique your interest, and you will continue to be interested and invested in those folks, including Dr. Helms, who's done this work for 3 decades now.
She was a baby.
Yes, since you were a baby. So I think, unless there's nothing else on my end, but I think that will do it for us this evening. I do thank people for their interest in wanting to join us again for this conversation, and extending the conversation and spending part of your evening with us, and with Dr. Helms in particular. I'm saying us, but really entertaining my desire to ask questions and to hear Dr. Helms speak at this particular time. You can continue to I would say, follow the ISPRC page for any future trainings that we might do, as well as information about Diversity Challenge. But for now, we say good night.
Good night, and thanks for listening to us.
Thank you.